While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. Just like previous variants, Omicron is hospitalizing people and it's killing people. In fact, the tsunami of cases is so huge and quick that it is overwhelming health systems around the world.
While the Omicron variant appears to be tamer than its predecessors, World Health Organization Director General Tedros Ghebreyesus warns against touting it as mild. This as soaring cases worldwide pressure healthcare systems. In fact, cases globally rose 71% last week, amounting to an additional 9.5 million infections. This is the highest weekly swelling of infections since the pandemic began. Deaths, however, declined, but the WHO notes that fatalities often trail case counts by 2 weeks. And over here in the Philippines, for the first time in 4 months, cases breached the 20,000 mark again. An additional 21,000 infections were logged today, as 2 out of every 5 people getting tested contracted the virus. Good evening, I'm Ed Lingao. You're watching The Big Story. Experts are warning COVID infections here in the Philippines are bound to balloon even further next week. In a bid to ease the pressure on the healthcare system as cases spike, the Health Department has revised its quarantine policies. Maricel Halili with The Big Story.
The Philippines starts the year with staggering COVID cases. The worst part, it hasn't even peaked yet.
Omicron will become the dominant variant here in the capital. It will be very scary for the next few weeks. It's really important to be vaccinated and to be boosted.
According to the Octa Research Group, Metro Manila's positivity rate is now at 46%, while nationwide doubling time is at 2.2. Professor Guido David says it's high time we'll look beyond NCR.
May nakikita na rin tayong pagtaas sa mga ibang parts ng Pilipinas tulad sa Visayas at sa Mindanao. May nakikita na ring bahagyang pagtaas. So medyo concerning yan na baka umabot na rin sa ibang parte ng bansa.
Given the soaring cases, the Health Department has recalibrated its quarantine guidelines so as to ease pressure on the healthcare system. Fully vaccinated healthcare workers who are COVID positive but are asymptomatic or only have mild or moderate symptoms will only be isolated up to 5 days. Close contact health workers will no longer be quarantined, but this will still depend on the assessment of the hospitals and health offices. For the general population, those who are positive but asymptomatic or with mild or moderate symptoms must be isolated for 10 days. A 21-day isolation, meanwhile, is required for those experiencing severe symptoms. As for close contacts, those fully vaccinated will only need a 7-day quarantine, while those unvaccinated or partially vaccinated will undergo a 14-day quarantine. Isolation facilities will now prioritize senior citizens and those with comorbidities. Home quarantine is also encouraged for those with asymptomatic or mild to moderate symptoms.
Kung kayo po ay positive at wala po kayong sariling kwarto at banyo sa inyong bahay, kayo po ay dapat dalhin sa isang accredited isolation facility upang maiwasan pang makapanghawa sa loob ng inyong tahanan. Paalala na ang lahat ng kasama sa bahay ay maituturing na exposed at kinoconsider na close contacts.
After this wave of cases, Octa's Father Austriaco believes the Omicron variant may be the pandemic's endgame, but some experts would like to temper that optimism.
Gusto natin na ito na yung pinakahuli, na wala nang susunod pang ibang variant. Unfortunately, hindi pa natin masasabi, no, with certainty na ito na nga ang katapusan ng COVID. Sana, no, sana totoo, sana magdilang anghel si Father. Pero siguro mas maganda pa rin maging maingat, huwag sadyaing magpahawa on the assumption na hindi na mahahawaan ulit ng iba pa.
For News 5, Maricel Halili, We Are One News.
After a week of multiplying COVID cases, how are hospitals coping with the influx of patients? That big question and more with Dr. Jonas Derosario of the Philippine General Hospital. Dr. Derosario, thank you for joining us and welcome back to The Big Story.
Good evening, Ed, and to your televiewers.
Yes.
Thank
Doc,
you for having me.
Thank you for joining us, Doc. Doc, let me start off with this. Yung revision sa policy na yung healthcare workers who test positive for COVID-19, their isolation has been reduced to only 5 days from 10. Now, I understand the strategy there being the concern na baka maubusan tayo ng tao sa mga ospital kung sakaling mag-spike nga. Pero I suppose it's a bit of a gamble. How are we sure or are we certain that, number one, the workers who tested positive will be cured already by the 5th day? And number two, would they have the strength to go back to work on the 5th day?
Well, alam mo, Ed, even in PGH, we are adjusting our isolation and quarantine protocols. It is because of this crisis, almost about 80% of our manpower are either infected or quarantined because of either exposure or, getting the disease itself. And if you follow the conventional guidelines, halos wala na po matitirang healthcare workers. So we have to adjust. Yes, we have to make sure that very important is in our protocol, if you are infected, you have COVID, we still follow the 10-day. You have to be isolated for 10 days, no? So that's very important, making sure that you are not infectious and you have fully recovered. And then there's also some leeway being given to our safety officer, no, to the head of the unit. They still also have to assess that healthcare worker, if that healthcare worker is really fit to work already. The big change really happened dun sa quarantine, no? Kasi again, we have so many healthcare workers now who have been exposed. Some have high-risk exposure, some have low-risk exposure. Yung high-risk exposure kasi there was a time 14-day quarantine. That's almost 2 weeks of
2 weeks.
Asking them not to go to work. So pilay na pilay po ang mga ospital. So now there's a new directive from our director that we really have to shorten the quarantine. In fact, if you're asymptomatic and you have high exposure, we don't even have to test, no? And then if you are symptomatic, we swab you. If it's negative, then you also go back to work already.
Yes, Doc. Pero Doc, in this particular case, the new policy is from 10 days for those testing positive na healthcare workers. It's now down to 5 days. Kinalahati po eh. Which also, of course, that does raise the question, are they well enough to go to work and not be infectious to begin with? Again, like I said, we do understand the need to ensure that there are enough people in the front lines. But at the same time, it could be a gamble that they could still be infectious.
The apparently CDC actually had these guidelines, no? 5 days, after 5 days, they can go back to work and they have to be wearing their masks. And they deem that these people are not infectious anymore.
Okay. Doc, one last question lang po, if I may. Kamusta po ang PGH? How is your occupancy? Are the numbers getting alarming?
Yeah, we had a steady increase of patients coming in. For the December 25, our lowest recorded number of admitted patients was 30. And then after almost 2 weeks, we're up to 250 and counting. And then also there are a lot of patients coming into our emergency room. So much so that we have to start reopening some of our COVID wards again. The only limitation that we have right now po is the manpower nga dahil madami po nagkakasakit at maraming na-expose. And that's the reason why we have to modify our isolation and quarantine protocols. Otherwise, hindi namin matutugunan yung we need to open more facilities for the COVID patients. At the same time, there are also a lot of non-COVID patients. So we're feeling the surge po, Sir Ed.
Okay. Doc, ingat po parati at maraming salamat for joining us tonight. Record peak in cases are being tallied in several countries across the globe. In Australia alone, cases reached another record with more than 70,000 infections logged. With that, the country has also set a new record for most COVID booster shots given in one day. Prime Minister Scott Morrison says over 220,000 booster shots were given. Meanwhile, India logs more than 90,000 new COVID infections on Thursday. Over in India, more than 90,000 new COVID infections had been detected on Thursday, its highest number of cases since their second wave in 2021. A similar case could be seen in Israel, which recorded 16,000 new infections this week, its highest since the pandemic began. Hospitalization rates, however, remain low in both countries. And 125 passengers in an international chartered flight coming from Italy test positive for COVID-19. The passengers arrived in India's airport in Amritsar. All 179 passengers on the flight were asked to undergo institutional quarantine. And these are the other big stories tonight. The Health Department walks back on its advisory on self-testing. It may release in 10 days' time guidelines on the use of at-home COVID tests. And it looks like the ongoing feud between EJ Obiena and the PATAFA is a step closer to being resolved. The pole vaulter reportedly agreed to mediation. And we celebrate the life of Philippine literary giant F. Sionil Jose, who has passed away at the age of 97. These big stories after the break. Good evening. You're still watching The Big Story. I'm Edwin Gao. After initially advising against self-testing without professional guidance, the Health Department is now drawing up rules to allow the use of at-home COVID test kits. Mobile journalist Pamela Vasquez gives us a front seat to the story.
As the country grapples with yet another surge, the Health Department is caving. It's now looking to approve self-test antigen kits and will release guidelines on their use by January 17. This will cover rules on waste disposal, interpretation of results, and what action should be taken when it comes out positive. At the moment, none of the at-home COVID tests available on the market is approved by the FDA.
Not all antigen tests are created equal. Iba ang antigen test na ginagamit ng mga trained healthcare workers. Iba ang direksyon at mas malalim ang pagkakatusok sa ilong.
This comes shortly after the Food and Drug Administration opened the door to manufacturers of self-administered rapid antigen tests.
I am calling for all the manufacturers and even the importers of self-administered COVID-19 test kits that to register their product in the form of a special certification.
Antigen tests are usually only recommended for those who are already exhibiting symptoms. Also, different brands have different sensitivities. For example, Abbott has a validated result sensitivity of up to 97.83%. Korean manufactured Nowcheck antigen test has a 91.4% sensitivity, while China manufactured Wonvo has 92.2%. The FDA has also been warning against the use of uncertified test kits, including brands like Longin and BioEasy.
Kailangan po guided kayo ng healthcare workers pag ginamit nyo to. And there is possibility of maling resulta at ito ay pwedeng magbigay ng false sense of security.
The national government may even subsidize at-home test kits once they are approved by the FDA, according to acting presidential spokesperson Carlo Nograles. Mobile journalist Pamela Vasquez, We Are One News.
When is it okay to isolate at home? The Department of Health releases its new guidelines for home quarantine. Facility isolation is strongly advised for symptomatic individuals who test positive for COVID-19. The same goes for COVID-positive patients who do not have a separate room and toilet at home and medical supervision nearby. So who are allowed to isolate at home? Home isolation is allowed for COVID-positive patients that show symptoms but have a separate room, toilet, and medical supervision at home. Finally, household members considered as close contacts can do home quarantine as long as they are asymptomatic and are not living with members of the vulnerable population, such as senior citizens or persons with comorbidities. As a rule, members who are COVID positive and are showing symptoms should always have separate rooms. 14 more cities and provinces in the country are placed under the heightened alert level 3 status as the number of COVID infections continue to rise. These include Bataan, Batangas, Cagayan Province, Pampanga, and Zambales. The cities now under alert level 3 are Dagupan City, the city of Santiago in Isabela, Olongapo City in Zambales, Angeles City in Pampanga, Naga City in Camarines Sur, Iloilo City, Lapu-Lapu City in Cebu, Lucena City in Quezon, and Baguio City. National Artist for Literature F. Sionil Jose has passed away on Thursday evening. He was 97. According to Jose's family, he peacefully died in his sleep at the Makati Medical Center, where he was supposed to undergo an angioplasty. Now, before the procedure, Jose posted on his Facebook what would be his final words, thanking his brave heart and thanking God. F. Sionil Jose is one of the most widely read Filipino authors and best known for the Rosales novels. The literary giant has mentored generations of aspiring Filipino writers. Jose was conferred the Order of National Artist in 2001. His family posted on Facebook that he wants to be remembered as the one who, quote, wrote stories and believed in them. Time for another quick break. When we return, passengers bound for Hong Kong recourse their flight plans as the city-state shuts its borders on the Philippines. After COVID exposure, Bongbong Marcos is a no-show in Comelec's preliminary hearing of his disqualification and cancellation cases. Talks between Paul Volter, E.J. Obiena, and PATAFA will soon be on the way as the Philippine Sports Commission prods both parties to mend ties. These big stories after the break. Good evening, you're still watching The Big Story. I'm Ed Lingao. As surges in COVID-19 cases grip the world, Hong Kong banned flights, leaving several Filipino passengers to recourse their plans. Mon Gualvez with the story.
Some overseas Filipino workers are expected to be stranded in airports. This as Hong Kong imposes a 2-week ban on flights from 8 countries starting tomorrow, including Australia, Canada, France, India, Pakistan, Britain, US, and the Philippines. Local airlines have started to either limit or cancel Hong Kong flights. Cebu Pacific has canceled flights as early as December after 3 HK-bound passengers turned out to be COVID positive. Philippine Airlines, meanwhile, has canceled a flight scheduled to leave on Thursday. AirAsia, on the other hand, rescheduled flights to January 30. But they also clarified that all other published flights from January 1 to 15 will continue unless otherwise stated by the point of destination.
Magkakaroon lamang po yan ng changes kapag nagkaroon din ng restrictions. Enough po yung ating manpower to sustain the operations. Yung buong pwersa po ng AirAsia Philippines ay fully vaccinated na.
All affected passengers of these cancellations were advised to coordinate with their airline companies. They can also contact their travel agencies for a refund. For stranded overseas Filipino workers, however, OWA assured assistance.
Nandun yung mga roving teams natin sa airport may case merong mangailangan ng tulong.
For now, OWA Administrator Hans Kakdak says that they are receiving calls about the travel ban. But no OFWs failing to board flights to Hong Kong have been reported yet. He attributes this to airline companies' swift coordination with passengers about flight cancellations. OWA also further assures that their helpline is always up and ready. For News 5, Mon Gualvez, we are One News.
The Commission on Elections proceeded with the hearing of disqualification cases against Bongbong Marcos, even if the former senator was a no-show due to COVID exposure. Greg Gregorio with the story.
The preliminary conference for 3 disqualification cases against Bongbong Marcos was delayed for an hour. The reason, Marcos was a no-show due to sickness.
Where is Senator Marcos Jr.?
He is not feeling well and he cannot join in today's video conference.
He is sick.
This infuriated Comelec 1st Division Presiding Commissioner Rowena Guanzon recalled that the cases separately filed by Ilagan et al., Akbayan et al., and Abubakar Mangelen were all raffled to the 1st Division.
Why don't you ask your client to go on Zoom? Even if it's on isolation, he can have a laptop.
His absence nearly cost him the chance to defend himself or present evidence.
Do you know the consequence under the rule? It will be submitted for decision without his
memorandum,
without his evidence.
But Guanzon asked his camp to simply show a medical certificate instead. The division proceeded with the stipulation and admission of issues and marking of exhibits as evidence. Among the issues discussed was Marcos's 1995 conviction for tax evasion and non-filing of income tax returns from 1982 to 1985. The Court of Appeals ruling was also highlighted, but it only affirmed the conviction and non-filing of ITRs, not on tax evasion.
The admissions that he made, I think, works for us. And like I said, it's part of the records naman.
At the latter part of proceedings, Bongbong's camp presented the medical certificate from his physician stating that the former senator was exposed to at least 2 COVID-19 patients. His doctor said Marcos is now experiencing symptoms like fever, body malaise, and sore throat. The division gave the parties 48 hours to submit their respective memoranda before the division decides on the matter. Mangelen's petition, meanwhile, has been submitted for resolution due to non-appearance of the petitioner or his counsel. While Ilagan and Akbayan's cases have been consolidated, for News 5, Greg Gregorio, we are One News.
For the big story in sports, after initial hesitation, Paul Volter, E.J. Obiena agrees to sort things out with the Philippine Athletics Track and Field Association, or PATAFA. Obiena had reportedly agreed to a mediation through a letter he sent to the Philippine Sports Commission Chairman William Ramirez. This comes just hours after PATAFA heeded the call of the agency for possible reconciliatory talks. Ramirez, however, did not confirm nor deny receiving Obiena's letter, but announced that mediation has already started. And meanwhile in tennis, world number 1 Novak Djokovic remains in Australian immigration detention as his legal team fights the government's decision to remove him from the country. Djokovic was denied entry into Australia amid criticism over his vaccine exemption for the Australian Open. The tennis player was told to leave the country following a 10-hour standoff with officials at a Melbourne airport. Australian Prime Minister Scott Morrison stressed that rules are rules, and that Djokovic will need to prove that he has a genuine medical exemption from COVID vaccination. The Serb, who vocally opposed vaccination mandates, has yet to reveal if he has received his COVID shot. And after over 2 years of closure, Star City is finally reopening. But is this really the right time to reopen? In its Facebook page, Star City announced that it will have a soft opening on January 14. The amusement park halted operations after a fire broke out in its premises back in 2019. Now, since then, the park stayed closed during the pandemic. While the thought about the park's reopening may be exciting, plenty were also concerned about the timing of the reopening, especially amid the surge in COVID-19 cases. And who can blame them? Star City management has yet to announce whether their soft reopening will push through next week. And that wraps up today's big story. Catch us again tomorrow at 8 p.m. on Signal, Channels 8 and 250. Please like our Facebook page, One News, for more in-depth analysis. Visit our webpage, onenews.ph. Mask on, wash hands, and stay safe, Philippines. On behalf of Robbie Alampay and Gretchen Hall, I'm Ed Lingao. We are One News. Good evening and happy weekend.